Welcome to ALC Global Health Insurance. We are here in Sussex, Stenning at Whiston House. We're all gathering together as a team to have a debrief on all that has been achieved this year and all that we're excited about for next year. You'll be hearing from the CEO, the MD, the sales team, and see us all in action. I hope you enjoy it.
Unfortunately, her dreams weren't realised, so that's why I'm here. Yes. And it's an opportunity for us to all get together and for us to provide you with an update on developments and things that are going on with ALC. And that enables us to get you all together in one place. So I would like to recognise their loyalty and in recognition and their commitment to ALC, and in recognition of that I would like to give them a small gift.
Any words, Becky? So, because every time they literally get an answer straight back, and of course it's 8 o'clock in the evening.
Yeah, so, and in the future, if we had offices around the world, we can do that, because we will have people working on different time zones. See?
Will that email have an expiry date on it for the client?
So the secure website link doesn't have an expiry date. The secure access code has a 3 days expiry date, which is explained in all the emails, and you can request a new code through the link if it expires, which is auto-generated. So yes, it does. Doesn't really mean anything. So to make, so we've got a step-by-step process, and it's 4 steps, which we're going to go. I'm just going to briefly show you the screens of what happens. But the first one is to click on the secure link, enter your code, check your details, complete your billing details, and edit your card details. But we'll see that now. So this is the first page that you'll be presented with. You copy and paste your secure access code into the box and press proceed.
Clients to ensure that they get the appropriate medical treatment, especially where you've got providers, for instance in Hong Kong, where people will perhaps be forced to stay in hospital, suggested that they should stay in hospital for 4 or 5 days. The medical professional at Helix will be able to say, well, actually, you only need 2 days inpatient stay for that. That's helpful for the client because at the end of the day, they don't want to stay in hospital for longer than they need to. It's helpful for us, of course, because it keeps our loss ratio down.
And as we've added here as well, it's great for groups as well. This is a message to go to groups. If we're talking to groups, you've often got the administrator, HR person, a finance director there who's just as much as anything worried about renewal premiums, having this kind of clinical expertise, and as Joe said, knowing the medical protocols.
Where next year hopefully will take us, and the developments that we've worked on in that period and how far we've come. Because I think sometimes you should take a few minutes out to just hold where you are and look back at what you've done. Those of you who ski will be familiar with that. You know, sometimes you look up at a mountain and you think, oh my God, I can't do that. And then you do it and you look back up and having done it and you think, hey, I'm good. I just did that. And, you know, sometimes I think in business terms it's good to look back and say, you know, we're not that bad after all, are we? But I just want to hook into the 2 messages that Joe and Clive gave you specifically, and Sue in that presentation about easy to buy from. The answer is yes. Because that goes to that word there, attitude. It is all about how we approach our day and how we approach our tasks. So, attitude's nothing new. I'm not giving you a new message here. This is not, you know, brain surgery or, you know, anything dramatic. It's been going for a while. Perhaps not 2,500 years for Aristotle. That's quite a bit, but it's up there. You know, everybody's always recognised that the way you look at stuff, the way you respond to stuff, impacts on what you produce and how you think about what you produce. Well done, Angela. Angela gets an extra bonus this year. I can't believe everybody else hasn't run here and sat here now.